we'll look at their data shortly as well. But here you can see Zonion's okay, so this person's gut wall maybe, it's not severely damaged, but you can see here the diamine oxidase is very low in this patient, and histamine very high. And after 5 weeks, so if you look at the markers, it's 511 to 623. So we're up, not even at 6 weeks. We are seeing with just the biocidin liquid and the GI detox that the plasma histamine level is coming way down, almost not detectable. And the diamine oxidase is almost up into the normal range. And this was actually an accidental draw. They did an early sort of reassessment. They were supposed to wait until 8 weeks, but it was kind of, I guess, kismet that they did it here because we were seeing earlier activity because of that. So here is our lipopolysaccharide antibodies, which is a way for us to identify the inflammation or how the body is responding to lipopolysaccharides. Again, that metabolite, that inflammatory metabolite in the gastrointestinal tract, obviously creating systemic effects when you can see that they're mounting an immune response against the lipopolysaccharides. So in just 5 weeks, we see IgA, so that's the one in the gut, the oral mucosa. It's that antibody that first meets that things from the outside world on our mucosa. You can see very high. So this person's gut was irritated, right, by lipopolysaccharides, and in just 5 weeks, it's still in the red, but it went all the way to the other end. And what we're looking at really here is immunomodulation. So we may expect to see this swing again. Ideally, what we want to see is for it to come back all the way into the normal range. And I know Dr. Burdette does talk about immunomodulation and watching antibodies swing, and we were talking with Jay's at Precision Point yesterday, and I'm really hoping what we can do is combine this testing with food sensitivity testing and not work with food sensitivities at all, but just watch to see if overall their food sensitivity levels drop when we work with the microbiome. That's what I suspect will happen, but stay tuned for that data, but we don't have this yet. So IgM starting to come back up again. So again, immunomodulation. This is a second participant. And in this one, you can see diamine oxidase very low, coming back up into the normal range. This patient had an elevation in histamine in the mid-cycle test, or in the middle of the treatment protocol. And I thought it was interesting. I don't know if what we're seeing here is biofilms opening up because biocidin does have activity against biofilms. And so there's no way really for it. They maybe got, because their zonulin is so high here, they may have gotten a hold of a food that they're sensitive to. We don't really know what is happening in this picture in the middle. But I thought it was interesting then to watch the immunomodulation as we go on. I would love to answer your question, but can I wait till the end? Is that okay? Okay, so interesting, right? At the end, diamine oxidase comes back into balance, histamine comes down, and you can see the ratio then of diamine oxidase to histamine going to 51, which is where we want to see it up in that green zone. So again, same picture here, lipopolysaccharides at 6.87 to begin with, for IgA, LPS, IgA. At 6.87 and down to 3.04, and IgG from 2.57 up to 6.6 or 6.16. I mean, the numbers probably don't mean that much, but basically watching this immunomodulatory effect go on in the body. It's pretty exciting, and it's reproducible, right? So every person that we're looking at so far has the same pattern. And so I'm really excited I'd love to have a chance to sit down with Dr. Burdette. I'm hoping to do that soon, to have her make sure I'm not missing anything when I interpret this data myself. But again, look at the diamine oxidase here, it doubles. This is hot off the press, March 8th data. And so this person was 3 months on the treatment protocol, and you can see moving from 30.54 to 66.57, so doubling the diamine oxidase level, histamine coming well down into the regular range, and then the ratio again going, I don't even know how much higher, right, to 224. And same thing again, so immunomodulatory effects of working with the microbiome. IgA coming down. So think about the inflammation that person was experiencing in their gut that's been relieved, and that's how I think about that. And look at this person's LPS IgG is off the charts. It's not even on the level. And then I guess 3 months later, we're seeing it down at 3.27. So still in the low range. So I don't know if we'll have to keep tracking we plan to keep tracking some of these participants to watch the swings happen in their antibody levels and see if we can identify immunomodulation, sort of where we'll land when it's done moving. But all moving in the right direction. So really important too is if we're working with an antimicrobial, How does it affect beneficial microorganisms? So we did work with Sun Genomics on this research. They do full genome sequencing. They have great testing. And you can see this is pilot research. And I just pulled these four. They have, you get a report and you can look at all. They basically identify whatever's there. That's the nice thing about full genome sequencing is you're not just looking for a certain microorganism, they tell you what's in the stool. So Campylobacterium presidency, I put that there because it's one of the producers of butyrate, which is a systemic anti-inflammatory. Lactobacillus and bifido, obviously important probiotic species. But what was really exciting was that we had 8 out of 11 of the participants had an increase in Akkermansia, which is a keystone species. And it's a placeholder for diversity, right? And so we already just talked about the importance of diversity for robust health, but also to keep your histamine or your vitamin oxidase levels up, right? So to help heal the lining of the gut. And 69% of people on Biocidin with no probiotics had an increase in probiotic abundance. So it is a selective antimicrobial. When I was using it clinically, I thought it didn't seem like we need to do the same restoration that we would after a load of antibiotics, right? Where all the beneficials are wiped out, of a certain kind are wiped out. I never saw that, but it's really nice to have the data to show us that that's the case. And this is just an illustration of each color is a different person, and you can see the abundance along the bottom, the total abundance going up in most of the patients. It did go down, but really marginally, like a tiny bit in a few patients. And to me, I feel like if we can take pathogen load down and just marginally affect or even improve probiotic health at the same time, that's definitely a win for our patients. So I brought this one in to illustrate sort of the systemic inflammatory effects that the microbiome can have. This is by Dr. Pam Hyde. She brought it to me at A4M in Vegas way before COVID hit, right before COVID hit. And she's actually doing our webinar Wednesday in June, so if you want to hear more about this particular case, because it's pretty complex what happened for this case, you can look at the timeline. It's 8 months. But she did this neuro read at the beginning, and this is a dementia patient. And her brain was very inflamed. She did a whole slew of supplements, so maybe 23 that included our biofilm cleansing program, and that's the Biocidin liquid, and the GI detox, and also the Proflora, which is our probiotic. And the patient had, so it stopped the progression of her dementia. The supplement protocol did, and she felt better. She had mild improvement, but the caregiver couldn't stay on all of this. He couldn't, for his wife, he couldn't keep her on all of these supplements. So Dr. Hyde pulled out our protocol, our products, and then the patient got worse again, and then brought it back in. So if you want to hear more about her, all of the ins and outs of that case, I'm really excited to hear her talk about it, because she's very passionate about it too. But what we're seeing then is that the microbiome and dysbiosis and the inflammatory mediators that are produced there have an effect, a distal effect in the brain. And so just really interesting, and it's always, I love data. It's like Christmas for me. Test results back. Okay, so just what happens wanting. What's the test results? So biofilms in clinical practice. This is something that's really important. I hit this pitfall when I started using Biocidin. I did not understand biofilms, and I thought my patients were reacting to Biocidin. They were not reacting to Biocidin. I've actually never since then have I had anyone that cannot tolerate Biocidin, even from newborn babies to frail elderly people. And one person with an oregano allergy that couldn't take it. That's it. So anyway, what happens when you start taking Biocidin is that it breaks down biofilms. The biofilms are really sticky. They are so sticky they're used in bioremediation, and they hang on to things like oxalates and histamine and other inflammatory mediators. So when you are, and behind those biofilms, you may have organisms that the immune system is not even interacting with, right? And currently, that need to be addressed, but it's not, the immune system is sort of like happily going along its way and not dealing with those microorganisms. So when you start to work with a biofilm, it's really essential that you include a binder. Especially the first few bottles of Biocidin are ideally ongoing, and partly the binder, we don't know which role, how much activity it's playing in reducing histamine, because everything that's in the GI detox also binds histamine. So it could be part of the reason that we're seeing histamine come down as well in the participants of that research. So using those two things together, it makes compliance much better. It will make the patients much more comfortable. If they are detoxifying and if they are working with biofilms, it can cause problems and damage if you're not really careful with it. So just please remember to include the binder as well. So the extracellular matrix, which is the kind of all that sticky mass, is composed of PAMs, or pathogen-associated molecular patterns. So it can also irritate or cause inflammation or systemic inflammation. There will likely be multiple organisms at play, so a biofilm is never going to be just Candida or just E. coli or just Klebsiella. There's usually multiple species biofilms in the body, and they all work together. It's a survival mechanism for them. So not to be forgotten is that we do have LPS production in the mouth too. So down in the periodontal pocket, porphyromonas gingivalis is now being linked to many, many different illnesses: cardiovascular disease, Alzheimer's disease, systemic inflammation of all sorts. And even there, LPS stimulates histamine-forming enzymes. I think this is mirroring data, but in the dental pulp and gingiva. So this was another light bulb for me, is that LPS in the gut, we have a ton of LPS produced, right? Because we have beneficial organisms that are gram-negative bacteria as well. But we have that first pass in the liver, right? So the enterohepatic circulation will, all of that LPS goes first to the liver clears it, it's like priority molecule for clearance. And so LPS actually is what causes septic shock, right? So if you have an infection outside of the gastrointestinal tract, you don't get that first pass clearance of the liver, and that includes the mouth and the periodontal pockets. So just remembering that working in the mouth, if you hit that, I really did a disservice to my patients in not understanding the importance of oral health and periodontal health, and it's the most common inflammatory disease on the planet right now, right? It's periodontal disease. So just making sure that we're also not leaving out the mouth. And it's one of the nice things about having a liquid product. We also do have a toothpaste and an oral rinse. So if you know that you want to work with that area with the patients, you have that therapeutic available. So the power of botanicals. So this is where I get a little almost weepy, because we get to work with botanicals. To me, they're sacred. They come from Mother Earth, and I'll just tell the story. So at Biocidin Botanicals, we understand that microbes are not an enemy to be eliminated, but an ecology to be nourished. How do we do that? By working with the gift of botanicals. Plants have developed tools to grow and flourish under the same environmental stressors that we face. They have an innate capacity to protect themselves, producing antimicrobial compounds, antioxidants, biofilm disruptors, and immune modulators. Yes, plants have immune systems too. So each plant that let's say you pick oregano, it has multiple activities. It will have biofilm disrupting activity, and it will have antimicrobial activity. It's an antioxidant. And so you think about the multiple activities, and then you add those into a formula, and it becomes a powerful synergy. So we think of all of these activities just from this one little bottle is antimicrobial. And there are many more, but the ones that I have put here in these bullet points, we have research showing these things. Antimicrobial activity against biofilms, protective antioxidant action, and immunomodulation. The outcome is not additive, but exponential. And remembering that botanicals, we can't replicate them. So we can try to create, histamine blockers, we can try to do decongestants, we can do lots of things to work with histamine, but we cannot recreate what the earth can recreate in a plant, and all of the different molecules that it creates, the phytonutrients. And so I am so grateful to be working for a company that calls on the wisdom of those plants. I mean, we literally have been working with them for millennia as a species, and our bodies know how to interact with them. So remember, it gives us the power to thrive. So what is biocidin? I'm going to try to get through that. I'm going to try to get through this as quickly as I can. So biocidin was developed by Dr. Rachel Fresco. She's here today. I'm so excited to have her here today. And over in 1989, so it's been around for a little while, and it is a combination of 18 essential herbs and essential oils. When she developed it, it was being used by doctors in the Bay Area to work with HIV patients to help them keep their pathogen load at bay. And one of those doctors submitted Biocidin to Great Smokies Diagnostics, and the head of the lab called Dr. Lee, and please, Rachel, hop in if I say this incorrectly. But he said, what is in this? Because it's killing everything that we put it against. And at that time, they put it on the CDSA, there's a comprehensive digestive stool analysis testing on over 250,000 stool samples. This was the most highly sensitive substance. Candida, Klebsiella, E. coli, staph species, I'm missing some, but you get the picture, very broad acting in terms of its ability to create inhibition in the body. Or actually, that was on the stool test, not in the body. So it's a pretty potent drop-wise. It's one of the nicest things about it as a practitioner is you can start with a drop. So you can modify or titrate the dosing based on the patient's tolerance. And I think that's why for me it's such a gift, is that you can work even with the most sensitive patients. You can almost always find a way to work with the biocidin and the antimicrobial. We have a pretty carefully curated line of 10 products. 7 of those products contain biocidin, so that's because we have the microbiome everywhere, right, on the body. And depending on where you're trying to get, you would select your biocidin, and then we have 3 support products that are available to bring in and to sort of boost the activity of the biocidin. So we have biocidin liquid, and then that's in the capsule and the liposomal form. And we also have the GI detox, which is the binder. We have the oral line and the throat spray, which we have a human clinical trial on. And then we also have the Olivirix, which is a very potent olive leaf formula, and our probiotic Coflora, which is spore-forming microorganisms. So biocidin, we kind of talked about this already, but we know it does work with biofilms, has immunomodulatory activity as well, and it will address inflammation through multiple activities. So if you're working outside of the gastrointestinal tract with the microbiome, then we have the liposomal form of the biocidin. For me, this has been indispensable. I live in northern Minnesota, and we are highly endemic area for tick-borne illnesses. And for me, I can't help myself, I'm going to tell you guys, this is the way that I think that biocidin is the most, for me, it has been so dramatic to watch acute tick-borne illnesses respond, people with acute tick-borne illnesses and animals with acute tick-borne illnesses respond to the use of the liposomal biocidin. I'll give you a case study. So my dog, Dorothy, is an 11-year-old, she's 85 pounds, and last summer she I had to take her out of my office. I was trying to record a webinar and she was snoring. So I was like, Dorothy, come on. So I turned it off and I'm trying to get her out and she couldn't get up. And I had to help her get up, and she was trying to walk out of the house and she fell down the stairs. And I loaded her in the car and took her to the vet, and she had acute borreliosis and anaplasmosis, and her platelets were 45. And the vet said, she has to go on Doxine right now. And I said, I want it for just a few days. And then separated her from my other dog who's all over her to make sure she didn't bleed out. But overnight, her symptoms, so I went maybe a little higher than the typically recommended dose on the LSF, but overnight her symptoms resolved. So in 24 hours, she was back to normal. But 3 days later, her platelets were over 100. And so that ehrlichiosis or anaplasmosis affects the hematopoiesis, right, in the bone marrow, and so it affects platelet production. So it's pretty dramatic for me, and I don't at all want Dorothy to be sick, but I'm very grateful for sort of the reinfusion that I got of passion about this product from that experience. So really, for me, living where I do, one of the things that biocidin has done is to help me go into the woods without fear, which I'm very grateful for, because I know I have an effective therapeutic in my hands. So that's liposomal biocidin. So we think of tick-borne illnesses, but also all viruses are intracellular. You're trying liposomal products. We do have research, in vitro research, showing 74% better transcellular absorption with the LSF as opposed to the liquid biocidin. So both were effective at killing Borrelia when we looked at, or when Dr. Gilbert did the research. But we did see this movement of the liposomal across the cell membrane, which if we're working with viruses, if we're working with any of the stealth pathogens like chlamydia or babesia, mycoplasma, all of those things are intracellular. So if you want to get there, you need, or maybe you don't need, but it would be a great benefit to have the liposomal form of the microbial in that way. So GI detox I've talked about, it's a combination, it's our best-selling product. It's a combination of activated charcoal and zeolite clay, additional silica. Again, it's a formula, so what we're looking at is broad spectrum activity. And so things like mycotoxins, And of course, we think of preventing the Herxheimer reaction that comes when you're working with the microbiome in any sort, whether it's Borrelia, which is part of the microbiome when you think about it in that way, right? Or whether it's gram-negative bacteria in the gut. When you're killing it off, this will mop it up so that you don't have the same damage to the body or discomfort. Oh, I did end on time. So here's, I guess, what I would say is that this has been, there are a few product lines that changed my practice and it became sort of staples in my toolkit. Biocidin and liposomal biocidin and GI detox, this line of products is one of those things. I wish I'd learned about it in medical school because it was a bit of a disservice the first 5 years of practice that I had before I learned about that. But I did learn about it, and I'm so grateful for it, and just give it a shot and see, let us know too how it works. And the other thing is we have a research department, so if you do have a patient you'd like to try these products with, let me know, reach out and let me know, and we can do a case study together. We're always trying to collect data, or we are always collecting data. And that's all I have. So thanks so much for joining us so early in the morning. Did you have a question? Yeah.
How would you decide if the biocidin liquid versus the liposomal, and also in those studies, were there any dietary modifications?
Okay, so the question was, were there dietary modifications in the study? No. They didn't go on a FODMAP diet, they didn't change their diet in any way. We asked them not to change their diet. So the only intervention was the biocidin liquid and the GI detox. Okay, and then the second was, how do we know when to use the liquid versus the liposomal form? So the liquid, you can get some systemic effect, and I know this because before there was a liposomal, I have before and after testing with ehrlichiosis in a human in my practice. So you do get a systemic effect, but the liposomal formula is going to have a stronger systemic activity, right? So if you're working primarily in the gastrointestinal tract, or you want to stay in the gastrointestinal tract, then I would go with the liquid. It's also less expensive. If you're working in the bladder and sinuses, the middle ear, we do have also Markov's research that came back to me last night. Just so I get excited about this stuff. Like, we're seeing really impressive data. So get it up in the sinuses with anybody with chronic infectious illnesses in the sinuses. You didn't ask me that, but anyway, so I guess just the liquid in the gut. Oh, you have a question? We have Biocidin Academy now, so we have online, so kind of on-demand training. We also offer